Welcome to the Imagining the Future podcast. My name is Josh Duncan, and I'm the commercial leader at RadAI, and I'm thrilled to co-host this with my friend, colleague, and RadAI's Chief Medical Officer, Dr. Bill Boonn. And both he and I are so excited to have an absolutely amazing inaugural guest, but more on her in a moment. As RadAI has become one of the fastest growing healthcare software as a service companies, we're constantly intersecting with absolutely impressive and innovative leaders. And we share three things in common. One, a commitment to innovation. Two, a commitment to leadership. And three, a desire to bring novel technologies that have a positive impact to the hospitals, health systems, and practices that are serving patients throughout the country. That's what the Imagining the Future podcast is all about. And today's guest is an absolutely impressive innovator and leader. So I'm thrilled to introduce our inaugural guest, an absolutely amazing person, Dr. Tessa Cook. Dr. Tessa Cook is the Associate Professor of Radiology at the University of Pennsylvania School of Medicine, where she serves as the Vice Chair of Practice Transformation in the Department of Radiology. Dr. Cook is also the past chair of the Society for Imaging Informatics and Medicine, and I think as important, maybe more important, she's an absolutely amazing leader and mentor. Dr. Cook, we are thrilled to have you join us today.
Thank you, Josh. Great to be here.
Dr. Cook, we're so happy to have you with us today. We obviously go back a long ways, and I consider you a close friend. Obviously, we're colleagues, and I consider you a true leader in the field of radiology. As we go back, I'm trying to think about how we first met. Do you kind of remember that first experience?
Bill, well, first of all, call me Tessa. And second, I can remember when I first learned about you, because I think you were a chief resident and I got to attend your graduation from residency, I think, or your graduation from fellowship, because it was around the same time I finished my PhD. And people were raving about this guy named Bill Boonn and his buddy Woojin Kim and all these amazing things that, you had barely finished training and people were already talking about you. And then I get to residency and I'm pretty sure people said, you got to meet Bill, you got to meet Woojin, you got to work with these guys. So I'm walking in, brand new first year resident, completely intimidated already by the fact that I'm at Penn in their radiology program. And then can't remember, honestly, where I remember when I learned about you, but I don't remember where we actually met.
I think we first met when you were a medical student. You did a rotation, and there was a teaching pal project that you worked on.
You knew about that?
Yes. No, I think I helped to get that up and running. And
that's right.
I remember that was the only medical student project that was ever completed, that actually accomplished something. So
Wow.
kudos to you.
Well, thank you. I remember that project. I also remember that very old reading room that I was on, that we were in during that rotation. That's right. I'd forgotten about that.
Yeah. So, mentorship, I think is a big theme that I think you've hit on in a number of your talks in the past. And I just want to know, what does mentorship mean to you, and kind of how has it benefited you, and what do you see as how it's impacted the mentorship that you've had on others?
It's a topic I've been thinking a lot about lately, actually, Bill, because, I have to give a talk about this in a couple of months on this exact topic. And, one of the things I always struggled with early on in my career, because everybody would tell you, well, it's important to have a mentor. Nobody told you how to find one that was a good fit, what to do if it wasn't a good, there are lots of things in medicine that we sort of learn as we go, right? In addition to all the things that we learn because we're supposed to learn them. And that for me was always one that I struggled with. I think honestly, until I got to residency and, that we had this amazing environment that I was able to thrive in with you and Woojin and Kurt, Steve. But, and then I've sort of grown in career and become a mentor. And for me, mentorship is really, helping people figure out what they're excited about, helping them invest in that space, but also being a sounding board, because especially as you're in your training, even before you get to postgraduate training, it's hard to figure out what you're supposed to be doing and where you're supposed to be investing your time. And I think that's something that a mentor can really help with. In addition to helping you make connections in the space that you're excited about and, growing in that community and becoming a part of that community. And that I think has been an area that I've absolutely benefited from over the years.
Right. And, do you have any advice for someone who's kind of seeking, a mentor in medicine? I think that, I've been very lucky in my career, and I've had a number of wonderful mentors that have really helped me achieve, all the things that I've been able to achieve and kind of get to the places that I wanted to get to, provide, amazing advice. For those who are looking for mentors, how would you approach that?
It's tricky sometimes. I think a lot of it is serendipity. And I think for that reason, it's important to sort of get exposed to different areas that you might find interesting, get a sense of what you do really enjoy working on, and make those connections. And, I always tell the residents here too, because we all sort of organically find the residents that are interested in the same thing that we're interested in. They find us. Sometimes formal mentorship works really well, and sometimes it doesn't. And it's just different for everybody. And I think the trick is to not just sort of sit and wait for the mentor to find you. Is you kind of have to put yourself out there, figure out what you're excited about in the world, in your future career, and try to get connected to those people. And I know, I'm sure it happens for you too. You get emails sort of out of the blue of, hey, I'm interested in informatics. I try to make time to talk to all of these people, even if it's, a 15-minute conversation while I'm driving home from work or something like that, just because that's how it started for me. Right. And I want others to have those opportunities. I'm saying everybody's going to come work, for me and do a project with me, but at least to have someone to sort of bounce your ideas off of, ask your questions of. It's one of the things I think that's really special about our informatics community, especially, is that we're all excited to meet people who are excited to get involved in the field and to kind of bring up that next generation. So I would say if you're looking for a mentor, find someone that's doing something cool and just start a conversation, if nothing else.
That's great advice.
Looking through your list of accolades, I mean, you won a number of awards, whether it's at Penn or at a number of national organization awards as well. One of them that at least stood out to me when I was looking through your CV was the Dr. Root Day Off Award for the Advancement of Women in Medical Imaging Informatics. I get what does it mean to you to be well-known female leader in this space, and how is it impacting women in the field and those consider going into radiology?
Yeah, it's truly an honor to have been the first recipient of the Day Off Award from SIM. And actually, it was even more exciting at the annual meeting this year. Her family was present, and it was really, phenomenal to meet her husband, her daughters, and learn about what inspired them to create that award and all of her amazing and pioneering work in the VA and informatics over the years. For me, as a woman in this field and as a mother of two daughters and looking at, what they might want to do with their lives someday and how they might craft careers, it's important for anybody aspiring to something greater to be able to look at that next level and say, hey, there's someone there that looks like me. They can do this. I can do this. And so I think if nothing else, I want to be that for the women that are coming up in this field. And for my girls too, to say, you know what? She did it. I can do it too. And it doesn't mean it's easy. It doesn't mean it's any less work, but it can be done.
Yeah. Well, I'll tell you, Dr. Cook, I think you are that example. There's no doubt about it. And I think it's amazing that you're willing to give 15 minutes of your time to people who are aspiring to be in informatics. That's tremendous. But I bet lots of people are going to be tuning in to this podcast and they may not be able to get 15 minutes with you. But I bet hearing from you, advice from you will be really powerful for them. So specifically for aspiring female leaders, whether it's in radiology or whether it's in medicine? What advice would you have for them?
It's a tough road. I won't lie, but there are people to support you on this road. And I think particularly when it looks extremely frustrating and it looks like it feels sometimes like everything is going not the way that you want it to go, reach out to your network, form that network of people that can support you, that you can just bounce ideas off of, that you can honestly just vent to, because sometimes we all just need to do that. And find people who are, sometimes not even part of your organization. I am so fortunate that I have so many mentors outside of Penn, for as many mentors as I have here as well, and have had over the years. It's the world is so small in some ways now because we're all so connected and can be connected. And I think it's really important that if you aspire to lead in any field as a woman, that you have support and that you can, tap into a network of people that are going through it with you, of people that have gone through it before you, and just have that guidance and have those mentors and those sponsors.
Yeah, that's great feedback, Dr. Cook. I mean, I think, obviously one of the themes for us on our podcast is leadership, and mentorship is a big part of that, both being mentored and mentoring other people. But the other thing that we really hope to focus on our podcast is innovation, because physicians, in particular radiologists, with the rising demand for imaging and the number of radiology residents and fellows who are graduating who just can't help close that gap, there's a lot of burnout amongst physicians. And it's really going to be innovation driven by physician leaders like yourself that I think are going to help make a meaningful impact. And you've been a leader in imaging informatics, workflow optimization, artificial intelligence, patient-centered care. What drives that, right? Like what makes you want to push the boundaries, Dr. Cook?
I like solving problems, like fixing things. It gets me in trouble sometimes, but I really, I get so much satisfaction out of seeing something that was frustrating or difficult and finding a solution to it. And now it's not frustrating or difficult anymore. And it made that tiny little bit of impact, or sometimes it made a big impact. And so really that's what drives me. I think it took me a long time to sort of think about, it's like, what are your goals in life? What are your goals in career? And it sounds really sort of silly to say out loud, but, I struggled with that question. I mean, to some degree, honestly, still struggle with that question because I couldn't have predicted sort of what this career would look like. And, I've many times sort of sat in my office and sort of stared at the wall going, right, where are we going from here? What do I want to do next? And sometimes I've been very fortunate in that I've, to some extent gone where the journey has led me and had an amazing time. But at some point in that journey, I realized this is what I really like doing. I like fixing stuff. I like coming up with new ways of doing things, or just different ways of doing things that are just slightly easier. And, every little bit that we can improve in our workflow now, Josh, you mentioned there aren't enough new, radiologists coming into this pipeline to fix all of these things just by having more radiologists. We need creative ways of working. We need, innovative solutions. And that's I think figuring that out for myself really has helped immensely, because now I pick opportunities based on areas where I think I can make a difference in that way.
And just for our audience, I mean, any particular projects that you or the Center for Practice Transformation worked on recently that you're very proud of, or that you really feel like has had an impact?
Yeah, I think the one that I'm most proud of, well, two actually. I mean, I want to give a shout out to my team here at the Center for Practice Transformation, because we've worked on a lot of things within the radiology department, but we've also worked on a lot of things that have touched the enterprise more broadly. One of the guys in the group, Charlie Chambers, has been working very closely with the Cancer Center here and has built a couple of applications that will go into the EMR, pull out data from various disparate sources in different form and compile it to help the oncologists and the cancer care team to get patients on the right therapies for their specific cancer. So, really a personalized medicine application. And without exaggeration, and these aren't even my words, it's saving lives. And so I'm super proud that we had a small piece in that. The other big project that we've been working on for quite a few years is looking to close the loop on imaging follow-ups. We put recommendations and reports all the time, right? And then we kind of lose track of what happens to those patients. And sometimes you get feedback because you read their follow-up study and sometimes you don't. And so we started years ago in this department to say, you know what, we're issuing the recommendation. We can take some responsibility in helping to make sure it gets completed. And so we've had a few projects that have run over the years. We had a pilot that started during the pandemic that has now caught the attention of senior leadership in the enterprise. And so they've taken sort of the prototype of what we've done, which has shown, just in a small pilot phase, about a 14% increase in completed follow-ups. And we're looking now at scaling this across the enterprise. And it's not just the application, but it's the whole process. It's the program, right? And so it's really gratifying, and I'm excited to see kind of how it develops from here. But we're super excited about that too.
Dr. Cook, you're obviously at a incredibly prestigious academic medical center, right? And for those of us who've been in startups, who've worked with academic medical centers, we can appreciate the clinical leaders there and the challenges that it can be sometimes of moving innovation or bringing innovation to it. I mean, obviously, it sounds like Penn is incredibly supportive, and congrats on what an amazing follow-up pilot that you all built. But for those who may be at academic medical centers that might not be as easy to work with as Penn, what do you think are some of the ways that they can overcome the challenges of really bringing innovation to their system?
I think one of the things that really helps is looking for the small wins. It doesn't have to be, we built this, huge software application with hooks into everything you could imagine. It can be a small process improvement that maybe has, a number of manual steps in it at the beginning because that's all you can manage in your environment. But if you can even show impact at a small level, then that gets hopefully buy-in and resources from the people that can support that work and help you to scale it. And, even though we are at a big academic center, we kind of had to do the same thing, right? We had to sort of get a little credibility as our small, we were literally the small little team in the basement of the hospital. And, we had to kind of do a little good work first and say, hey, look, we're kind of onto something here. Can you support us with, more access, a little bit more in terms of resources and guidance? And so I can fully sympathize. We had, we were very lucky to do what we were able to do, but it wasn't easy at the beginning. And there was a lot of, asking for help and asking for resources and saying, look, we think we're onto something here. Can you at least, support us, and going out to various primary care practices and, going up to our sort of enterprise level Center for Practice Transformation and just getting the right help and getting, the right connections as well.
Well, Dr. Cook, it sounds like the team in the basement was a small but mighty team.
They still are.
That's right.
Yeah. So, Tessa, we have very similar backgrounds, and I think very similar interests, in radiology and in informatics. But we've kind of gone in different directions. You pursued a very successful, academic career. I've kind of gone more on the kind of commercial pathway. But I think they're more similar to kind of what we work on than is different. As a healthcare system like Penn that does a lot of its own innovation, what do you see as kind of a healthy relationship between, academic institutions, that are developing their own AI tools, versus, commercial entities?
That's a great question, Bill. And I think the thing is that we can't succeed without each other, right? Is that for as much as we innovate in this space, we sort of get to a point where if it's really going to be meaningful, it has to translate over into the commercial world. And, it has the greatest potential to spread beyond our organization and to help other organizations and help patients that are cared for in other systems in that way. But similarly, the industry sort of, relies on academia for some of the good ideas that they get out into that world as well. And so I think there's a real opportunity for this nice symbiotic relationship, and I realize it doesn't always work out that way, but I think there's real opportunity there, and certainly something that we've experienced locally.
Dr. Cook, just a follow up to that. I mean, obviously, there's what good looks like, and there's what good doesn't look like. So when you think about the vendor relationships that you've experienced through what you've been doing and innovating at Penn, are there common themes amongst vendors? Like, these are the behaviors, or this is the way that they interact with us that makes for a good vendor partnership versus those that aren't?
Yeah, absolutely. I really appreciate the vendor partners that I can, reach out to and sort of have a good line of communication to. And the ones that listen to us and listen to our challenges in turn, I mean, I've had conversations where it might be a good solution, but it's not the right solution for our environment.
Mm.
And sometimes that's a difficult message to actually get across. And so those conversations can be frustrating, but I think the relationships that are really successful are the ones where, there's a degree of mutual respect and sort of an appreciation for the fact that the mission of either side of that relationship is different, but also, has, as Bill said, has some common themes to it. And I think the ones where we really succeed and are able to, sort of contribute to each other's missions are the ones that are most successful.
Yeah, that's great feedback. I hope all the vendors that might be listening, I hope they take it to heart, Dr. Cook, because ultimately it's the great partnerships between vendors and academic medical centers that I think can really kind of close the gap for us in addressing a lot of these issues, in particular physician burnout. And speaking of things that may address physician burnout and may be accretive and assistive to physicians and hospitals and health systems, is artificial intelligence. And I'm sure it's on everybody's buzzword bingo card now. AI, Gen AI, large language models. There isn't a conversation that I'm in where I don't hear one of those three words. But clearly, radiologists as a physician specialty, I don't think anyone would argue that they aren't the most innovative, that they haven't really kind of led the charge in embracing technology. But still, AI doesn't have deep penetration, even amongst radiologists and hospitals and health systems and even radiology practices. So what do you think needs to be done to overcome that and get AI in the hands of more physicians, in particular radiologists?
I'm glad you asked that question, Josh, because I gave a talk on this actually earlier this week, but it also relates back exactly to the previous question that we were discussing, and I think that there are a couple of reasons that AI isn't as ubiquitous as maybe we all thought it was going to be 6-7 years ago. And I think one is that the solutions are built to solve a problem, but are not necessarily built to solve that problem in the clinical workflow. Because it's one thing to segment a tumor or find a lung nodule or find a critical finding on an imaging exam. It's another thing to do it in a way that is so seamlessly integrated into the radiologist's workflow that it's going to help them to be more effective, more accurate, deliver better care, create a better patient outcome, just be less exhausted at the end of the day, because quite frankly, that is a metric now that we should all sort of be thinking about. And I think the way to get to sort of that higher level of adoption is to bring the AI developers and the clinical domain experts closer together and more frequent. This was sort of, this has been kind of something I've observed over now, a couple of decades working in medical imaging and in medical image analysis, is that when you start to use an application and it starts to feel like the engineers designed it in a vacuum and never actually spoke to a radiologist, it gets really frustrating And it makes me not want to go back and get anything else from that company because I don't feel like they're actually designing products to help me do my work better or care of my patients better. And so, I think the real value there is by bringing those two experts or those two expert groups together during the process of development and invention and innovation, because otherwise it's the proverbial hammer looking for a nail and I guess that makes me the nail. I don't know.
It's a great point, Dr. Cook. It's really interesting. When I joined Rad AI, I want to say I was maybe 2 years into it. I had a radiology leader like yourself, I really respected, and we were having a conversation at a conference, and they told me, "Do you want to know why your company has had the success that you've had?" And man, of course, I love to hear people's perspectives, and I told them, "Yeah, I would love to it." And he said, "It's because you're led by physicians, right? You've got physicians who are at the table helping to kind of drive things forward." And I also look at this in a way that relationship between academic medical centers and leaders like yourself and practice leaders is equally important to make sure that things aren't designed in a vacuum. That's so well said, Dr. Cook. Like things done in a one-off box are never going to have the impact that we need. And we need lots of things to make sure that we're making a positive impact on physicians and patients. Bill, any thoughts?
Yeah. One other thing, Josh, quickly.
Yeah, please.
I sympathize with our vendor partners, right? You're trying to build an application that fits the needs of a very diverse customer base. We get that. But at the same time, we're not going to buy things that don't fit in the environment, don't make a meaningful impact. And I guess that's part of the fun and the challenge of being an entrepreneur, right? Is building a product that's gonna meet the needs of a variety of customers in different environments.
Yeah, you're right.
I mean, you've highlighted, I think, one of the biggest roadblocks that that AI faces in terms of adoption, right? Just fitting into the workflow of the radiologists themselves. But do you also see other roadblocks, whether it's from organizations and institutions or from vendors themselves? Like what other types of roadblocks do you see towards greater implementation and adoption of AI in healthcare?
We could sit and talk about the regulatory challenges probably for a whole other hour, and I am hardly the expert. But I'll throw that one out there because I think that's a real challenge that we're all sort of grappling with, whether we are, whether you're the AI developers or the customers. But I think there's still a healthy degree of skepticism around AI. There's still, I feel like 5 years ago, there were sort of two groups of radiologists, right? There was the group that said, you know what? I don't know what this newfangled thing is. I don't need it. I can read my cases and take care of my patients just fine. And then there was the other group of people who said, I wanted to do this. 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 Oh, it only does one of these things. I'm not interested. Right. And then there's everybody in between. And I think that spectrum of doubt, for lack of a better word, still exists. There's certainly the financial aspect of this because every, healthcare delivery organization is struggling financially to one degree or another, and new technology is expensive. But I think there is still that sort of desire for, a panacea almost. And I think we all have to realize upfront that AI is not going to be that for us, that it will speed us up one day, but it's going to slow you down at the beginning. And I think that, one way to just get around that is to get it in front of more people. I've heard from practices that use a lot of AI solutions. I've heard from practices that use hardly any. And there's almost this activation energy, if you will, right? You have to get it in front of your radiologist. They have to start using it and interacting with it and learning what it can and cannot do. And then once you've done that for a few, the next ones maybe don't seem like such a burden because, I'm saying the quiet part out loud here. It does slow you down at the beginning, right? You have to learn how to interact with it. This is a new tool in your workflow that you haven't used before. You're going to have a healthy degree of skepticism about it, as you should, because you're using it to take care of patients. but we have to get over that hump, and we will with time and experience. But it is that to take an already busy radiologist and a radiology practice and say, hey, you want a thing that's going to slow you down? It will speed you up later, but it's going to slow you down today. That's tough asks.
Absolutely. I agree 100%. And, it's kind of, I think one thing that's driving potentially some, a change in heart amongst a number of radiologists in terms of adoption of AI is burnout. I think that, the volumes continue to increase, and, the supply of radiologists certainly is going to meet that demand. As someone who's been involved with a lot of initiatives to kind of address, potential burnout issues and things like that, where do you believe that, technology can help to address burnout within healthcare?
I think it has a real role, because one of the things that in the early days when we first started to sort of pay attention to burnout and how big a factor it was in medicine and particularly in radiology, so many of the solutions were focused on the individual. I remember there was an initiative that said, oh, well, we have this new service. You can, when you leave the hospital at 7 p.m., you can just pick up dinner and take it home to your family. I don't want to leave at 7. I want to leave at a reasonable hour and go home and make dinner with my family. And so, I think having solutions that are system level focused rather than individual focused, right? Because the goal is not to work a 12-hour day and then go to yoga. That's not going to fix this. We need, and technology can help us with that, right? We can take all of these areas in a perfect world, we would take all of these pain points and inefficiencies in our workflow and innovate around them so that they didn't exist and they didn't depend on the radiologist having to adapt to an imperfect environment, rather than having systems built to make the radiologists work easier or any physicians work easier. I mean, we're in the radiology world, so we're talking about radiology, but I don't think any of that is limited to our specialty by any means. But I think technology has an opportunity to enact system level change rather than putting the onus on the overworked individual to figure out how to care for their own wellness. Not that isn't, important also. We all have to sort of, take care of ourselves and, it's like put your own mask on for helping others, right? Take care of yourself so you can take care of everybody else. But it really helps immensely when your organization, your system can support you in doing that.
Do you have any specific, examples of technologies or things that you'd like to be able to solve that could help address burnout in your daily practice?
I have an AI wish list, Bill. It's long. I don't think we have time for that one.
How about the top 3, maybe?
Well, if we want to get into the weeds about AI and radiology workflow, especially, I remember, doing the lecture circuit some years ago and talking about, what? I want AI to go into the chart and save me the 10 minutes I spend digging around to find out why this patient is here for cardiac MR today. I want AI to do that for me, right? The number of times I showed that slide and, here we are 7 years later with large language models, and that could very well be a reality soon. But it's those kinds of things, right? There are things that computers are good at, the humans are inefficient. We should have computers do those things. There are things that human experts are very good at. Computers are not so good at. We should have the humans do those things. But instead, what we've decided to do is say, hey, look, dog X-ray, CT scan at the picture, right? It's all the same. We can just take the same thing that worked for cats and dogs and apply it to complex medical imaging. And for some use cases, there is a translation there, I fully admit. But also, I think everybody in this space has realized over these last 5-6 years that this is a harder problem than we thought. And I think, unfortunately, because, so much of this was inspired by ImageNet, we've focused a lot of energy in places that it's harder to really make inroads. rather than on sort of operational efficiencies that I think would be much easier for AI to innovate and disrupt.
Absolutely. Maybe let's look towards the future a little bit. I mean, as someone who is a leader and an expert and a visionary in radiology and healthcare, what do you see as kind of the most pressing changes facing the healthcare system today and over the next 5 to 10 years, particularly in radiology? And how should we as radiologists prepare for that?
I've heard a number of sort of sobering talks in the last couple of weeks. We at our state society meeting, Eric Rubin talked about, the workforce shortage. He talked about it from a very interesting perspective, which was, is it that we don't have enough radiologists, or is that we have too many imaging exams? And depending on which way you approach that problem, the solutions can be very different. And then, we had an amazing grand rounds this week from Jay Parikh, who talked about burnout and potential solutions there. And I think all of that is really tied together, right? We keep looking at that graph that we see everywhere of, volume over time, right? And it just keeps going this way. Whereas the supply of radiologists is flat. And the number of jobs on the job boards is paralleling the number, the volume increase of exams. So there are too many patients who need care and not enough of us to deliver care. And so I think that is the biggest challenge for the next 5 to 10 years, because, we're not magically going to increase residency spots. We're not suddenly going to find, the secret to keep people working, well past when they should reasonably be working. And I think we need technology and innovation to help us with those things. And we need, a culture shift in medicine as well, I think. But that's always the hardest one, right? Is to change the culture around how we take care of ourselves, how we take care of our colleagues, and how we take care of our patients. But looking ahead, I would love to, 5 years from now, be looking back and going, man, how little we knew. And we have all this amazing new technology that solved all these problems. ChatGPT was not a household name 2 years ago. So things can happen, right? Inventions will come up, but we also can't just sit around and wait for those. So in the meantime, we have to figure out with what we have, whether it's technology, people, resources, what we can do in the short term. But I think that is really the biggest challenge.
Yes, Dr. Cook, it definitely is the biggest challenge. I would say a challenge for me is about what I'm going to say next, which is my 2023 World Series champion Texas Rangers have been eliminated. And so it's a challenge for me to say congratulations to the Philadelphia Phillies. They have clinched the division.
Yeah. And the first round bye.
That's right. Tough for me to say, but I want you to know I'm pulling for the Phillies now. I'm pulling for the Phillies to go. But it kind of brings me to my next question and where we'll close, Dr. Cook. So, one of the things that's very big at Rad AI is this whole mantra of the 3 C's, which is to care about our colleagues, care about our customers, and care about our communities. And clearly a big part of community is family. So I'd love just to kind of have you share your perspective of how you balance excellence at work and excellence at home.
I don't know if I like that word balance. It's not balance, Josh, I won't lie. It's, I have learned in the last few years sort of the value of boundaries. And when I'm not working, I really try to not be working. Unfortunately, as a physician, I'm working a lot. I've been on call the last 2 evenings. My kids don't go to bed until I'm done working, which is hard. And, it's really annoying that I really love my job, because if I didn't like it so much, maybe it'd be easier. But I don't really have any secrets, it's really important to try to kind of work time is work time and home time is home time whenever that's possible. And I also, I'm fortunate I have an extremely supportive spouse who picks up all the balls that I keep dropping on a regular basis. But, I also, again, I've got 2 little girls, and I think about my parents were teachers growing up. I don't think they spent a night away from home ever when I was a kid. And, as I'm about to leave for my third consecutive weekend of travel tomorrow morning, my kids are growing up very differently than I did. But I also want them, I said this to my older one a lot, is you might grow up one day and you might have a job that you really love and that you're really excited about. And you might have a little one at home that job takes you away from. But you'll be able to say to them, you know what? My mom did that when I was a kid too, and it was okay because she came back and she still got to do all these really cool things. And, as she's getting older, so she's, we're approaching double digits now with kid number 1. And she wanders into my office often when I'm working. She goes, what's that? What, she's starting to get curious about science, about radiology. And, I think for me, it's just sort of modeling that you can have a career and you can have an amazing, fulfilling career. And you can still have a family, and those things are not sort of separate. They don't, they don't respect time limits. Like I'm seeing all these text messages on my phone that are, I'm sure, about something that has to be figured out for this weekend when I'm not here. But everybody figures it out one way or another, and we should all get to follow our dreams, even though some of us don't entirely know what those are at any given moment.
Yes.
Included.
Hey, Dr. Cook, I'm still trying to figure it out, but one thing that I know that you and Dr. Boonn and I have in common is that we both all of us have to travel for work. And I know all of us love our families. There's no doubt about it. For anybody who's listening in and you do have to travel for work, a book that I'd highly recommend you go out and buy is The Invisible String. You'll absolutely love reading this book to your kids, especially if they're younger, because I think it helps them connect the dots. But Dr. Cook, I can tell that you are an amazing mentor and role model to your 2 daughters. You're an amazing mentor and role model to so many people in radiology and in medicine. I said it at the top of the podcast, and I'll say it again. We could not have been more fortunate to have you on as a guest today. I know people are going to love tuning in and listening to this. Dr. Bill and I are supremely grateful to you for being the inaugural guest on our Imagining the Future podcast. And we look forward to all the feedback that we'll get from those who listen. And we look forward to the future guests that we have lined up who will be joining us. You've set a super high bar for them to cross, Dr. Cook. Thank you so much for joining us.
Thank you, boss. It's always nice to chat with you. And I look forward to future episodes and to hearing from your next slate of stellar guests as well.
Thanks, Dr. Cook.
Tessa.
Thanks, Bo.